Hey, it's Chris with Road Dental Lab, and I'm here with T-Bone.
What's up, Chris?
How you doing,
What's
man?
up, folks?
Good
How
to
are
see
you?
We are at the Nonprofit Center. It's a 3D Smile, it's called.
Yeah.
We're here in Raleigh, North Carolina, and
Greatest place on earth.
obviously, kind of.
That's pretty close.
We're doing right now. We're doing a live course with Chrome Guided Smile in conjunction with 3D dentists and the doctors here, and they are doing live surgery, full arch with Chrome, and the doctors that attend the course are doing the surgery. And it's a very unique place to do that because most states, most areas, most trainings, the doctors just have to watch it. But here, they're doing it. So tell us a little bit about that.
Yeah, so obviously when we started full arch training, let me back up for a second. For me, full arch has changed the game in my practice. First getting into dental implants really kind of showed me the way that dental implants were amazing, a lot of fun, never-ending learning, really fulfilled my desire to help patients, my desire for myself to grow. And then when I got into full arch, then I was like, man, I can work less and do all of that. And then as that's been digitized, it's reinvigorated me for fun to continue to learning, because a lot of it you get bored, you get burned out.
Right.
And for me, that's what this is about. Okay. And then the way I learned to do full arch was in live patient training. For me, I was very lucky that my mentor, my oral surgeon, was my live patient instructor. So we would do the cases in his office. He would let me do the case. He was right there with me doing the cases. And it really overcame the fear and gave me the confidence I needed and the experience I needed. And so I just want to recreate that experience for everybody else, for them to be able to do that type of care, learn that type of procedure, and do it on live patients, because that's the best way to learn. Now the challenge is a lot of people don't know what kind of patient, what's a good patient. They don't want to find the patient, they want to fly the patient somewhere,
Right.
or they themselves don't want to go overseas. So we have created the ability for them to do the live patient right here. We provide the patient, we screen the patient, we make sure they're taken care of. These are patients from the community. They're working class patients that otherwise wouldn't be able to afford the care, and they're seen from beginning to end. In other words, we provide the restoration and we make sure they're well taken care of. Most of our patients are teachers, they're firemen, firefighters, they're just average people that need and deserve this type of treatment.
No, that's great. That's great. And a lot of the barriers to a lot of these full arch courses, of course, is getting that patient. So the fact that you do that, I mean, the attendees they got to fly, get themselves here, and that's pretty much it.
Yeah, and with our unique retreat, the experience is, I'm not trying to be salesy here, but the experience is unlike anything else.
No, it's very
you
true.
stay on site, you hang out. Like last night we had 12 people around the fire just sitting there talking till 9, 10, 11 o'clock at night, sharing stories, what's working in their practice. And to me, seeing that as an instructor really gives me a lot of pride and joy. Now, one of the things that we're seeing in full arch dentistry is there's two stages that people go through on full arches. One is, I want to get started and get into it. Okay, I'm doing some implants, I've got a decent surgical skill, I just got to get over that fear of getting to the next step. And that's where I believe guided full arch surgery is the best way to get started. Okay. Now what we do, I don't want to use the word unique, but it's a little bit unique, is that we focus on digital workflow. That's from the beginning side, from taking the records digitally to using you guys to do the Chrome guides. All that's done digitally with the planning. And then what we're doing now is we're using grammetry or the OptiSplint to show everybody how to take their surgery conversion and do that digitally and print it and paint on the gums and characterize it and deliver it. So that's kind of what they'll be doing here as well. And then the next step of it is what we see is people say, you know what, I'm good surgically, I'm doing 1 or 2 cases a month, or a case here or there, and they're like, now I want to go all in and I want to get to that 5, 10, 15 arch club. And that's where our Scale Your Full Arch business program comes in, and that's where we talk about marketing and phone skills and consult skills and the closing skills and the finance skills and how to build the infrastructure of printing and doing your own zirconia so that you can start creating that level of scale that you need, and how we work with lab partners to do the remote design, to do the zirconia for us, do all of that stuff so that we can make it fantastic. So and again, all of that comes from our own experience. I was just a few years ago that guy that was doing 1 or 2 arches a month, and now I'm in that 6 to 8 arch a month club, and Sully's in the 10 to 15 arch a month club, and so we've lived this, and that's what we're doing, and we just want to share what we're doing.
Yeah, no, that's awesome. And the nice thing about this course is you cover the full arch fundamentals. the hands-on with full arch, with guided, and then we talk about the restorative portion of that day, but then it's also an overdenture course too.
Yeah.
So there's 2 days of surgeries.
That's correct.
Thursdays, well, for this week, Thursday is a fixed full arch with guided surgery, and then tomorrow is your overdenture cases as well. So the doctors get kind of the full range of full arch here.
Look, our number one goal is we're trying to help patients. As dentists, we want to help our patients. We want to grow our businesses, and what we do know is that the overdenture market is probably bigger than the fixed market. It's more economical, it's all of those things. So to me, overdenture is the beginning point to get into fixed full arch. And what we teach is our overdenture workflow is built around getting our patients started and giving them an option to get upgraded down the road into fixed arches. Now, what we do is day one or Thursday is going to be live patient fixed surgery with a digital workflow. Day two, we do the overdenture surgery semi-freehanded so that we continue to build that skill set, because what we do know with fixed full arches is sometimes the bone quality isn't what we expect. These are, oftentimes more sick patients that have lesser bone quality. So we do need to know how to freehand things, and that's where we introduce that skill set for people so they can do it. So yeah, they'll get scientific training for 3 days with hands-on exercises, then live patients on Thursday and Friday with live patients that they work on. And the other part is you bring your assistants get in there, they learn, they go back and they're ready to go, and our team members are here training them so that they can see, it's essentially exactly how we're doing it.
Yeah, no, that's great. And then another thing I see with these courses that are done, if it's overseas or across the board, wherever it is, you never know what happens to the patients restoratively. And here, the doctors can leave with a good conscience, knowing that they're taken care of all the way through their final that final night.
And honestly, one of the things I pride ourselves on is our after course support. You're not just here with me for a weekend or a week. You're here. I want you to be part of our family, and that's the atmosphere we try to create. So we have our community app, and then we'll post pictures of the patients when they're done. We'll post the X-rays when we get complications. We try to post those things so we can have that discussion, and for the most part, you can keep up with the patients with what's going on. And then yes, we do provide follow-up care, and we do provide a final restoration for the patients.
Yeah, that's awesome. And could you take us through a quick little tour of the facility here?
Yeah, absolutely. Yeah, so we just built our new facility here. It's 5 operatories, and we'll use one of these rooms that's not being used today. And so we work obviously very closely with our partners. And what's important to me is that people have an opportunity to experience what they're going to experience in their practice. Now, our rooms are set up for surgery and not necessarily for general dentistry, because that's what we teach here. But number one, if somebody's looking at a new chair and they want to get the latest and greatest chairs, we have the Chefla Anthos chair here, which has a endomotor apex locator built into it, has an implant motor built into it. So this chair is what I use in my practice, has everything built into it. Now, the reality is most dentists are going to go back and they're going to have an implant motor. We love W&H, their implant motor, their attachment for the piezo is all there. So we have it here. We have PRF. We'll be doing PRF on all of our patients. So it's all here for everybody to have a good experience. Plenty of big rooms.
Yeah.
And then the next step will be adding video cameras. So that way we can, for the other attendees, so when you're not working, you can peek into what's going on and see what the other surgeries are looking like, because that's part of the learning experience. It's not just the case you're doing or the case you're assisting on, it's the other cases that are going on. And then each night we have a debriefing night when we sit back at the retreat, we talk about your experience, everybody shares what went well, what didn't go well, what was harder than you expected, what was easier than you expected, and it's that community that really breeds that confidence to go back and do well.
And I think that's one of the most valuable times is that after surgery debrief. I mean, because they come in, they place the implants, and they got all this stuff going on in their head, and the fact that it's a nice open environment and everyone's kind of hanging out, asking questions, joking around, but really getting down to business and seeing kind of how the days went, what questions they have, and that's one of the most valuable parts of the experience.
Like I keep saying it, we are family.
Yeah.
We want you to join our family. If you're not looking for a family and looking to be go all in and be, and really win in your practice, we might not be the right place for you, and that's okay. There are a lot of choices out there. But if you're looking for a place where you can build your career, learn the business skills, the clinical skills, the social skills, have a family environment where you have a community, we're fantastic. We really pride ourselves on it.
Yeah, awesome. We appreciate being a partner with you and appreciate you having some time with us.
Love you,
Thanks.
Chris.
All right, take care.
Thank you.
Love you.